Hello, everyone. Very glad to see so many participants to our third webinar covering innovative applications in the endocrinology area. I'm Godo Bosch, and I will be your host today. We are going to present the UPLCM-SMS state-of-the-art analysis of 1,25-dihydroxy vitamin D3, D2. Our two presenters, because we have two presenters today, are Dr. Jürgen Kolles from the R&D LCM-SMS scientist at Immune Diagnostic, who's located in Germany, as well as Davor Filitz, clinical support specialist, EMEA at Waters in Germany as well. The talk will be in English. Jürgen is a product developer trained as a chemist, but with science driving him. He specializes in developing innovative LCM-SMS methods for clinical in vitro diagnostic applications. And Davor, he gained a PhD in chemistry and has been focusing on LCMS techniques since, I would say. He's done method development and qualitative as well as quantitative mass spectrometry for 18 years. He joined Waters as an application specialist in 2020 and supports specifically our clinical customers with pre and post sales activities. Now, before I realized that I didn't change the slide, I'm sorry for that. So I would like, before we start, to show you a bit about the environment that we have. So on the top right, you have the bios of our two presenters. You can go back into getting more details about what they've done before. We'd like as well to get your feedback. So please fill in the very short survey that you have on the bottom right of your screen. If you move to the left, you have in the middle a small box that says enter your question. And really, this is what we want you to use. The slide moved without me doing anything here. So I don't know, sorry for that. So yeah, sorry. So here, yes, please use that enter your question box to enter your questions regarding the presentation, and we will answer them at the end during the Q&A session, which is a live session, like the presentation. And last but not least, you have as well some documents, information pieces that you can download that are in the middle bottom part of your screen. Today, we have two presenters and two presentation parts. So the first part is definitely about the method development, sample preparation, as well the method regarding the 1,25-dihydroxy vitamin D3 and D2. And then we'll have more details about method transfer possibilities, as well as some what I would call tips and tricks the application. And then without further ado, I will hand over to Jürgen to start with the first part of the presentation. Jürgen, over to you.
Okay, thank you, Godo, for the kind introduction, and welcome everybody to my part of the talk, which is called Sample Preparation and UPLCM-SMS Analysis of 125 vitamin D3, D2. So let's jump right in. What is vitamin D? Vitamin D is a group of fat-soluble saccharosteroids that are responsible for intestinal absorption of calcium, magnesium, and phosphate. They are mostly known for deficiency, cause diseases like rickets, and their role in osteomalacia and osteoporosis. There are two ways that you can actually get vitamin D in your body. The first being it's synthesized in the skin, mediated by sunlight, and the second one is that you have it with your food or diet. The two most important forms of vitamin D are D3 and D2. You can see the structures here on the right side, and they differ only slightly in the side chain. Vitamin D3 is mostly found in mammals and fish, while the origin of vitamin D2 is in plants and mushrooms. Since vitamin D3 is in humans the most important form, I will focus my talk on this one. So as I said, this can either be absorbed by food or synthesized from 7-dehydrocholesterol, which is also referred to as provitamin D3 in the skin, mediated by UVB light from the sun. In the next step, the vitamin D is hydroxylated in the liver in the position 25, resulting in this so-called storage form of 25 vitamin D. This is also the form that is mostly measured in labs or in clinics. This form has two more metabolic pathways that are very important to it. First is a hydroxylation step in the position 24. This leads to the so-called inactive form, and this is the natural protection mechanism from the body to avoid an overdose of vitamin D and therefore toxic effects. The second very important pathway is the hydroxylation in the position 1, as marked here. This is the actual active form of vitamin D. This is the one binding to the vitamin D binding receptor, here short VDR, and this is then responsible for the uptake of calcium from intestines and an increase of the calcium levels in blood. Another very important metabolite is the so-called free epimers. In the liver, there's an epimerase that can epimerize the hydroxy group in the position 3. This also leads to an inactive epimer. This is found in higher proportions in newborn, but it's also linked to certain diseases, and elevated values can be a hint that something's going on. The problem with this one is that a lot of tests are not able to distinguish those two, and therefore you will get incorrect values. So additional challenges of measuring 125 vitamin D is that the majority of it is bound to the vitamin D binding protein or albumins, and there's only a very low concentration in blood. We're talking about picomolar range here. Also, as I mentioned before, there are various vitamin D metabolites, including epimers. A lot of tests need extensive sample pre-treatments, and a lot of tests are also not able, as I said, to distinguish between the metabolites. And this may result in incorrectly elevated values that you get from the test, which is not good. More LCMS-specific challenges are the poor ionization efficiency, for example, and the high matrix background you obviously get from biological sample types. So how do we overcome these challenges? For the poor ionization efficiency, we went for derivatization. This activates the molecule, leading to improved ionization efficiency and therefore also better sensitivity. The high matrix background is removed by antibody purification, which leaves us with very clean samples. And for the metabolites, they are obviously taken up with the antibody because they are structurally very similar to the desired analyte. We have to do an optimization with our chromatography. And here's the overall workflow. Looks a bit overwhelming, but I will guide you through this. So in the first step, we add our samples and an internal standard into the plate that is already filled with the antibody slurry. Then we incubate this for 60 minutes. And then we remove everything that is non-bound by washing with 3 successive washing steps. Then we elute the analytes, evaporate solvents, and now we're ready for the derivatization. So we add the derivatization agent and then derivatize for 60 minutes, evaporate our solvents again, and then finally we're ready for the residue to take up in solvent and inject it directly into the LCMS. So this is a pretty straightforward progress, and you might ask now, yeah, okay, but is this really addressing all the challenges I mentioned before? And the short answer is yes. And now I will show you some highlights from this. So here you can see the chromatographic separation. Here in blue is the 125 D3. This is the analyte that we want to measure. And the other colors stand for metabolites that have the exact same mass. So we really need to separate them by chromatography because we can't by MS. You will also may notice that you can see this clear double peak here. This is an artifact from the derivatization, which causes the 125 to end up in two isomers that are poorly separated. Ideally, this here will be shifted completely together, but you can see for the other analytes, this might shift quite a lot. But you can also see that the 125, so the analyte that interests us, is clearly separated from everything else that's going on. Here on the left side, you can see the lower limit of quantification. So here the line in blue is for the D3, the 125 D3, and the green line is for the 125 D2. And if you follow these colored lines down here, you can see that we actually hit concentrations around 1 picogram per milliliter, while the D2 even dips a bit lower. So this is outstanding sensitivity for this analyte. And here on the right-hand side, you can actually see the chromatographic result or the peak shape that you get. And here in yellow, this is for 1 picogram per milliliter. You'll still get a very nice signal, which is also due to the extensively low background, which really highlights the power of the antibody purification. We also looked in the matrix effect, as you can see here on the right side. So 100% is 100% matrix, while 50% is diluted with water. And what you can see from this graph is that from left to right, the concentration stays steady. So this indicates that we measure the same values from pure matrix as from water, so there's no specific effect of the matrix whatsoever. What we also looked into is a different kind of matrices. Here you can see the correlation of the citrate plasma with the serum. So we measured from 50 different patients a sample from citrate plasma as well as serum, correlated this, and as you can see, this gives a really nice correlation, which is also true for other types of plasma that we use. So to finish things up, if you're interested more in this test, you can scan the barcode here on the bottom right. But just to give you a few highlights, you can measure this from serum and all common types of plasma. It's less than 4 hours of hands-on time to perform the assay for 96 samples. The LLOQ is outstanding with 1 picogram per milliliter. The method is very robust. You get CV values below 3. And this is the first IVDR certified kit for the measurement of 125. And with this, I want to hand over to Davor, and he will pick up right where I left off and will tell you how easy it is to actually set up a new method like this on Waters instruments. So Davor, your turn.
Yeah, thank you. What I'd like to show you today is you came to me with the question, we developed this kit on a Waters instrument. We'd like to provide a little bit more data to our customers also on other Waters instruments. Are you able to support us with some analysis in your lab? And actually, what we did together will be exactly kind of the workflow you will have to do once you bought this kit and try to install it. That's why I'd like to give you some details on how to set this kit up and what to expect. So Jürgen came with everything already, ready to use. So he brought his solvents, which are coming from the kit column, all the liquids you need for washing the sample needle, for example. He came with the samples already prepared. So what we did first, we installed the column, we installed all the solvents. This took approximately 5 minutes. So the next step, the next step was then to prime and to equilibrate everything. So we purged all the lines and we started the column equilibration. While the LC was running, we already used the tune mix, which also comes as part of the kit, and we tuned the compounds in. We've been using a so-called tuning algorithm, which is called IntelliStart. I'll give you a little bit more details on how this works and what you can do with it later on. But just in general, so the amount of time to spend approximately per compound is 5 minutes. So in total, we tuned in 4 different compounds, so vitamin D2, D3, and the internally labeled standards, so which took us in total approximately 20 minutes. So as a result of this, we got this lovely results. So we could tune all the currents in, the daughters in, the collision energies were set for us, all the other voltages you need. So we used, as I explained, the automated IntelliStart tuning. We check the report if everything's fine, and then we continue from there on. So with this set, we had already a MS method ready to go. The next step was then to write the LC gradient as it is. So I just used the literature we got, so it's in the kit's manual, how to program the gradient. We just copied the gradient over to our inlet method editor, and we've been ready with the LC method as well. Another 5 minutes, and then we were already able to run the first test chromatogram. So we used quite high standard. I ran a test chromatogram. As you can see here, I smoothed it a little bit more to overcome the double peak of the peaks. We've seen a nice peak for vitamin D2 and its eternal standard, and also for D3. We used this chromatogram then to check and to process the data. So after target links processing, we clarified if everything's all right. So we checked first the peak symmetry and the peak width, the tailing factor, if the chromatography looks like as expected. We also checked the retention times. If they are as expected, everything was fine. We checked the baseline noise to avoid any kind of system contamination, which would then interfere with our sensitivity. As this was also fine, we checked the response of the lowest calibrator to see if we still see a peak. And when we detected the peak, we've been ready to go. So in total, it took us 45 minutes to set this kit up. Actually, this will also be more or less the workflow you're doing in your lab. Once you buy the kit, you'll be ready in something like 45 minutes with your first tests. To give you a little bit more details on how we support you with this tools and what you can do on the instrument. So if you really want to set it up. So first of all, good news for everyone who doesn't want to have a black box. We're still providing a tune page with all accesses to all relevant source parameters, the heat, the voltages, and so on. So you can do your setup completely manually if you want to. The Vortis instruments are coming with an inbuilt fluidic system. So there are syringes which are delivering your sample directly into the source. You can also decide to combine it with your LC flow path to mimic at least, the environment the compound will arrive at the source, and then tune it in. You can set collision energies there and do everything manually. If you're not so happy about doing something manually and you would rather skip this step, you can just observe the ion of interest on the tune page and then start a software which is called IntelliStart for an automated tuning. You can get access directly from the Vortis software. You just click on Start, and what will show up is a page like this. So you can just type in the names of your compounds in there. Here you type in the molecular mass or the formula of the compound. You can choose what kind of adduct you'd like to test, set some voltages here, set the number of MRM transmission you'd like to acquire, and then click on Start. So it'll automatically find the precursor for you. Depending on the adduct you've selected, you can test more of them individually in the same run. Once the precursor was found, it will be optimized, fragmented. The fragments will be found. The 4 most intense fragments will be then sorted for you and optimized regarding collision energy. So as an outcome, you'll get a complete ready-to-go MS method containing all the compounds you've included in here with the information you need. And you can just select this auto-dwell functionality. With this, you can set the maximal possible dwell time for your compounds to be done in a certain time to acquire a minimum desired of points per peak. I set 12 points per peak on a peak width of 4 seconds, and with this, the dwell time is automatically calculated for you. The last thing to add here, you can also set the fluidics valve from this page on, so you can divert, for example, the first minutes to waste and the last minute to waste if you want to keep your source clean. So there are more options to improve your method further on. So once the method is installed and running, there's actually no need to write new methods per hand or to tune things in again on a new mass spec. We deliver a so-called library, which is called Quampedia. It comes free of charge with the software you're using. So once you have an acquisition method and a processing method, you can just store it over there. So with this said, you can use this database to transfer everything to another instrument. So for example, you can just use Quampedia to import all your method details, which is here highlighted with the blue box. So the import functionalities, you can click on an LC method, on an MS method, you can import and build your methods over there. If you want to run a recently installed method on a new system, you just copy the database, and from there you can select if you want to run the complete method, if you want to run just single compounds out of this method. For example, you can select, okay, I'm only interested in vitamin D3 this time, D2 is not in my interest. I just copy the D3 transitions over to a new method, and the system will create a new method for you without any further interference. So what you also can do if you observe, for example, shifts in your retention time because you're changing to a new LC, or you're swapping your column to a new column and you see your retention times are moving away, you can just use this inbuilt functionality to update your retention time. For example, you can open the method and say, okay, please shift everything by plus 0.2 minutes, and all your transition will be just shifted for you, and a new method will be created by the software itself. So to give you an overview what we've did, this is our current IVD portfolio. So it starts with low-tier products like the RenaTDx system, which is typically used for newborn screening analysis. There is an entry-level MS system, a ZivoTQD, which is used typically for therapeutic drug monitoring. And the three instruments we're talking about today are on the right side of this picture. So what Jürgen did, so what Immune Diagnostic has got in place in their lab is the ZivoTQ system, a quite sensitive instrument. This is the instrument which was used to develop and validate the method you've recently seen. What we did in our lab is he came with some samples, and we tried to transfer this to the ZivoTQ Micro, a little bit less sensitive than the ZivoTQ, but kind of, or most sold working host in clinical diagnosis because it is suitable for really a broad range of compounds. And we've transferred the method also to our most sensitive instrument, the TQ Absolute, to check if everything's up and running also there. So this took us in total 1 day. So, but to be fair, it took us 45 minutes to set the method up on both instruments, and then we've been just running the batch overnight. So with, I would say, sample processing, data evaluation, it was maybe 1 day of workload to check if the method also runs on other instruments. We checked for sensitivity, linearity, accuracy, and precision. All these parameters look good on both sides. And to test this, Jürgen provided some samples, which he brought with him. So it was in total some blank samples, SST solution to check the performance of the instrument before we gave it a start. We've included 6 calibration levels, 2 independent sample sets. We've included 3 QC levels, also N2, and 49 patient samples, each injected once. The data acquisition was done with MassLinks. We processed data with target links to get quantitative results. And in the end, we've been verifying the results, checking the QC, the accuracy, the bias, sensitivity, linearity. And we did some calculations to compare the method to the original method set up in Immune Diagnostic Lab. So the results have been quite promising. So we plotted it in a Blend-Altman comparison plot to check the results compared to what Immune Diagnostic did in their lab. As you can see in this picture, they are a quite perfect match. So almost all samples have been within the error margins of plus minus 15%. these are the results based on the QC accuracy. So we injected QC samples and calculated a relative bias and the concentration which came out, and everything was in accordance to what we've acquired at the Immune Diagnostic. And we repeated the same calculations also for the XIVO-TQ Absolute system. So we also did the Blend-Altman comparison. The results were even better on this instrument. And the same is true for the QC accuracy. So also the QCs checked on the TQ Absolute system been absolutely okay. So the outcome was, in fact, sensitivity was okay, linearity was okay, the accuracy was okay, the precision was okay. So we successfully transferred the method to both instruments without any problems. It took us together 45 minutes for the setup, and then run the sequence, evaluated, and after 1 day, we had results on both instruments and could show it works quite fine. So if even the Compedia databases are still too complicated for you, we offer quite a lot different methods which you can just download from our homepage. And we also agreed with Immune Diagnostic, if you need the methods and if you want to install them on your instrument, just give them a shout. So you just have to provide the lot number of the product you just bought, and you can download the ready-to-go method directly to your PC and start with the acquisition with the general setup. So if you then still need some support, don't hesitate to ask us. So in Wouters, we build a clinical team of application specialists all around Europe, so we can support you wherever you are. There is always a backup. We have a general email address where you can reach out to all of our colleagues, and also you'll be able to contact Jürgen or other people from Immune Diagnostic if you need further support with your method. If everything's fine and running, or you've got issues with the instrument itself, we have an instrument service and support, and they will support you remotely with a call back within 2 hours, and you get an 48 hours on-site response time if really a technical issue is affecting your analysis. So also here we try to make you well, as productive as anyhow possible. If you're struggling, if you need some help, we'll be there backing you up. Yeah, and with this, I'd like to close the session now, and I'm ready for your questions.
Thank you very much, both Davor and Jürgen. Well, the talk was very interesting, and it generated as well several questions, which we'll go through now. Which one first? Okay, the first one that I would pick here, how efficient is the antibody capture step? What proportion of analyte is lost from the sample in the flow through? So that's probably more for Jürgen.
Yes, so the efficiency of the antibody for both the 125D2 and the 125D3 is roughly 80%. This is what the antibody will pick up from the sample. Otherwise, there's not much loss during the method.
Okay, so I mean, my interpretation of it is that it's very efficient and straightforward as well.
Yeah, I think this is mainly addressing how good the antibody is, and this is 80% roughly. Yeah.
Excellent. We have another one, which is it a PTAD-based assay?
This information I cannot share. I mean, what I can say is that we had a look in different derivatization agents. It took quite some time, and we also had some failures with the derivatization because this is a very sensitive step. But I can't say any details about the derivatization agent itself.
Okay, well, thank you. Yeah. Next one. Were urine samples tested with this kit?
No, just blood samples. So serum, EDTA plasma, lithium heparin plasma, and citrate plasma. Those four basically, and they all went through for the validation, and the correlation of all of them is very nice.
Okay, cool. Let me pick one for Davor, maybe. When I use Quantpedia and transfer my method to another Waters instrument, do I have to change method details like collision energy, or will they stay the same?
Well, it depends. So in most cases, you don't have to change anything. So we're providing the same collision energy as a traveling wave collision energy, and this collision cell. I'm sorry, the collision cell is built in every Waters instrument. So by making sure we're using the same gas pressure in our collision cells and they stay all the same, the fragmentation pattern behaves also the same. So you can really just pick the method as it is, download it on a new instrument. And you don't have to apply or change anything at all. There's one voltage which might change, and it's the so-called cone voltage we are using, and this only changes from the so-called non-step wave instrument, so the previous generation of our instruments, to a newer version. But there is a calculation automatism, so if you click on I'm transferring from receiver TQD to a TQS micro, for example, it will recalculate these energies for you. So you also don't have to do anything at all. So the question can be answered with no. Everything stays the same.
Cool. Okay, so next, are there some interferences with the 25 hydroxy D3D2?
No, there are not, but this is actually a funny story because we obviously checked all of the common metabolites for vitamin D. The 25D3 is just one of them. And the issue with this is that it's hard to get a certified reference material that is pure enough because this assay is really sensitive. I told you can measure down to 1 picogram per milliliter. And if you get 25D3, and this is like, let's say, 99.9999% purity, we could still detect the impurity for the 125D3. So it's hard to spike it in. We had to get a bit creative and try different samples and also pure reference materials for this case, but we checked it thoroughly and there's no interference with 25 whatsoever.
Excellent, thank you. Have you tested any other SP methods rather than antibody capture?
Yes, we screened quite a lot, different vendors, different plates, different materials. Again, I can't give you any of the details with this, but it was quite a thorough search for different materials or alternatives, yeah. And I can say that the antibody is definitely performing the best out of all of them. There are some that are good, but the antibody is just outperforming all of the other SP options.
Thank you. Could we quantify the 25 OH, D2, and D3 with this method?
With this method, no. So usually we measure in this assay just the 125, both the D3 and the D2, and the 25 we measure in a different assay that we also have. We might look into having a combined method. So one method that's basically able to measure all the metabolites of interest, also maybe the epiforms, but this is not sure. I can't say anything decisive about this. Might be worth looking into this, might be not, because the 25 is way easier. I mean, the concentration in blood is 1,000-fold higher, and it's way easier to measure it. So there are easier, probably also cheaper methods to get a good estimate for those. But we might think about implementing it to make a big panel out of this. But yeah, we will see.
Okay. The next one, most assays utilize a low QC of about 3 times the LLOQ. Why did you choose a low QC picogram per milliliter if the LLOQ was 1 picogram per milliliter on both the micro and the TQ absolute platforms?
Okay, this one is not so easy to answer. I think a lot of this is due to historical method development. For example, because we had the derivatization method, we had an alternative method. It was way less sensitive, obviously. And then we had the calibration material for this, and then we decided, okay, we can go farther down. But at this point, we didn't know the exact LLOQ that would come out in the end after optimizing every single step of the protocol. So we put it a bit higher, just in case. We didn't want to put the QC too low and afterwards find out, okay, we can't measure this. Even I was surprised that we even got lower than 1 picogram per milliliter in the end. This is really surprising. This is why we had it a bit higher, I would say. I mean, the lowest standard that we use is now roughly around 5 picogram per milliliter. There's also not a lot of people that actually want to distinguish between, let's say, 5 or 3 or 4. I mean, this is from a diagnostic point of view, it's very deficient. There might be some special applications where you want to distinguish this, but for the broad mass, this is fine. So 5 is the lowest standard that we have, and then if you want the 3 times this is 15, this would be then the first QC level that we use.
Okay, makes sense. I think I know the answer, but would it be okay to know the details of the column used for the validation and transfer of this method?
No. I mean, this is now a full IVDR certified kit. We also provide the column with this kit, and especially with IVDR, it's required to use everything. So also the column from the kit is mandatory, otherwise it will lose its IVDR status. And yes, obviously I can't tell you which column we used for this. I mean, this again comes from a enormous screening of the best possible column that we ended up with that really got a nice separation. And also when I went to Davor and we set this up, I also brought the column from Immune Diagnostic with me, and we measured it in this column.
Okay. I see twice, I think, maybe it's more than that, but I mean, I've seen it twice at least. The question about getting the slides of the presentation, I believe we'll be able to share most, if not everything that we have shown here. It will be, anyway, the presentation will be available as well as on-demand presentation, so you'll be able to watch it as many times as you want. Yeah, so the big question now is how do we get it to you? I mean, I've seen 2 questions. I believe we have your email addresses, so we can send it directly then to you. Okay, I mean, unless you have any questions about it.
To send out my part.
Sorry?
I'm absolutely fine with sending out my part, so there's nothing we have to hide there.
Yeah, no, I imagine that, and Jürgen, I guess for you it's fine as well.
I think this should be fine. Yeah, I don't think there's any sensitive data in this.
So again, I will repeat. So the presentation itself, as recorded, will be there on demand, so you can watch it as much as you want. And we'll have let's say, a cleared version of the presentation that we will send out to the people that have requested it. Okay, now next one. May I know where I can find out more information about Quantpedia? There are not many instructions available from Waters' website.
That's unfortunately true. The thing is, if you Google Quantpedia Waters, you'll quickly find a learning video. If this is not sufficient, I can provide you some training documents. So we've created within our group training documentation, also covering Quantpedia and how to use it. So if you want me to, I can send you over the training slides. If you still need me or still not familiar with Quantpedia or need me, just let us know and we can dial in remotely and I can show you the software then live. So Guru, I don't know, can you write down the name so we can send out the Quantpedia information then?
They are all in the list, so yes,
okay.
We can do that.
Great.
Next one, this antibody device can capture, it's a question, capture original vitamin D3?
So before the 25 hydroxylation then. To be honest, I'm not fully sure. I would say it picks it up to some extent, but I would have to look this one up.
Okay. Again, similarly, we should be able to get back directly if the email address works to this person later. I don't know how to phrase this question. I am interested in the presence of 125D3. Does it mean can I measure them with the kit, or yeah, I don't know.
The other like 24,
Yes,
25 or so. This is addressed in this way, or is the question in this way? I mean, what we did, what I would have shown in the chromatographic overview, that they are separated. The retention time could be a hint which of one it is, but since we have no calibration material, no standards, no quality control, we can't really say any quantitative statement. We can just from the retention time, you can assume that, okay, this from the retention time, it would fit to this analyte, which is a hint. I wouldn't take it for granted, but it could be like something to look into then. But then one would need to have to spike the analyte of interest into the calibration material to really get the quantification possible.
Okay. Okay. Yeah, you could modify, but yeah, it wouldn't be the kit by default, and then
it wouldn't be the kit. The kit is just for 125, though. Yeah.
Well, the next one we already got the answer. Is the LC column specific to the kit? I mean, it's implied. Yes, it is specific.
Yes, there's a column for this kit that's specific for this kit.
Okay. Next one, I think it was the same person which already had a question about IntelliStart. So I use IntelliStart and manual optimization at the same time, as I noticed that IntelliStart sometimes is not selecting the optimal collision energy and cone voltage. Do you face this issue while optimizing your MRM from IntelliStart?
Well, yes and no. I would say in 90% of all cases, IntelliStart gives you good results. I actually do the same. Once IntelliStart has acquired data for me and to show me a result, I infuse the compound, or I continue infusing the compound. I monitor it on the tune page, and I set the same cone voltages and collision energies which have been optimized by IntelliStart to check if I see the same results. In some cases, if you watch on your report, IntelliStart is sometimes less intelligent than the name suggests. It picks the highest value. So if you have a spike in your optimization, you see a clear Gaussian distribution of the sensitivity, and it picks some value left or right, and it is typically because of a spike produced. So in these cases, where something like this happens, I manually correct the collision energies. That's why it's always important to check your results. There are other cases where IntelliStart optimization fails completely, and this happens typically if your compound fragments to so many different pieces that it's hard to decide which of these transitions is the most sensitive ones. But yeah, then you're just doomed to do it manually. Well, I would say in 95% of all cases, IntelliStart gave us good results. We also once had a competition. So in our large demo lab in Manchester, where also the mass spec is produced and developed, we had a task, okay, we're running IntelliStart optimization, and the application chemists operating the instrument had to do a better job in a faster time. And actually they failed. So what they could do is improve the results by maybe 5%, but it took them way longer than the results produced by IntelliStart. So I would say in most cases you can really use it, but you should not use it without using your brain. So you should always watch out how the results look like, and in best case, double check them.
Thank you. So next one, how good is the separation of 24-25 dihydroxy D3 and 125 dihydroxy D3 using this assay, and what column was used? Well, okay, let's answer the first part.
Baseline separation.
Good.
Short answer.
Yeah. No, it's great. And then the column, of course, is a trade secret.
Column, of course, I can't include.
Yeah. No, that's fine. Oops, things have moved here. Okay, in the kit, why do we have 3 quality controls but 2 calibrators?
This is actually a good question. This is just from the amount of samples, I would say, if I'm completely honest. This was because it wouldn't make. We could also just put 6 in there, but then at some point someone decided we put 9 in there because it's close from the number. But actually, I can't give you a better answer than that. I mean, what you can think of is also how people use these materials. This we can't control. Maybe some people want to use more controls. For example, let's say you have a bigger batch or 2 plates, and then people might say, okay, we just put 1 calibration on the 1 plate, and the second one we just go for quality controls. I personally wouldn't do it, but it's possible, and it's always better to have more controls than less, I'd say.
Okay. Yeah, we are still on time, but getting faster here. How did you do the smoothing to remove the double peak? And would this have a big impact on sensitivity?
So we didn't do any smoothing. It's just the double peak. We just lived with this. We just optimized the column and also the gradient to have them shifted together. I mean, this is just 2 peaks that we shifted as close to each other as possible, while also ensuring that all the other metabolites are clearly separated. There are other columns, obviously, where you can shift them completely together, then you would see just 1 peak, but then we had issues that there were other metabolites overlapping or other interferences that we tested. So finally, we decided, okay, that we live with the double peak, we know it's there, but we can assure that it's just the analyte, nothing else, and everything that we want to separate and all possible interference that we looked at were clearly separated. This was the important part for us.
From my side, because I showed this smooth peak, so it was a 2-point smoothing in 2 iterations I used. So in the raw data, you see a small double peak, but just the top of the peaks you serve kind of 2 little tops. After a gentle smoothing, it was the standard smoothing we actually always use to process the data. We got a nice peak, but it's really due to the chromatography. So this double peak is so close together that that's really hard to see that there is a double peak, and with the general normal smoothing, which I always apply, it just disappears.
Okay, thank you. And then the last one is more request to get a contact, I guess, with you, Davor. It says, I would be pleased to get additional information about using Quantpedia with your TQS Micro and MassLynx 4.1. It never really worked out for us. Thanks in advance.
Yeah, I'll do so.
I think we can do that. And as you mentioned, I mean, it works in most cases and needs maybe some fine tuning, but there are as well some cases where, yeah, it's probably a bit trickier. Well, I think we are out of questions here. That was plenty already. So thank you very much for all the time spent with us. It was very interesting. At least I learned a lot. Oops, a last one coming up here. Is the kit compatible with mass spec from other brands?
Yes. This kit is compatible for most common brands, I would say. I mean, we tested a few, and every one that we tested, we have at least 1 instrument where it's running.
Thank you. Yes, so my comment on that, though I'm from Waters, I would say yes. The application has been developed on a Waters instrument, or at least we have shown it. But of course, if you have equivalent systems, it probably will work with the others. Might need some tuning and so forth. Okay, and then, yeah, we still have some questions about the slides. So yes, we will share the slides with whomever has asked for them. So don't worry. And if you don't get them, by the way, you can send a request to us. If you don't get them, let's say in a week time, don't hesitate to remind us. Well, thanks again. It was a great session. Thank you, Jürgen and Davor, for giving us this presentation, answering the questions. And I would say stay tuned for the next event that will be coming up soon. Thank you. Bye-bye.
Thank you to everyone.
Thank
Bye.
you. Bye.